good afternoon to you. I am Dr. Vinod Vijan, Senior Cardiologist in Interventions from Vijan Hospital, Nasik. Well, in reply to your first question, how do you define a healthy heart? A healthy heart does not mean absence of disease. It is in totality. It means a healthy supervised heart. Here, the patient is treated or rather supervised right from birth, because we find that we in India, unfortunately, or South Asians, have the highest prevalence of heart attacks and heart disease. And this disease starts in adolescence. And it is not uncommon for us in India to see a young man even in late 20s and 30s and many in 40s succumbing to a heart attack, which really shocks us. So that brings us to the point, when should we start taking care? Taking care starts even, I should say, from childhood, where a child is necessarily not overfed with chocolates and sweets. In fact, they should be taught the right way of eating from early childhood. That goes into the psyche much better. It is the childhood obesity. Even nowadays we see surprisingly childhood hypertension, which is becoming a very big problem not only in the economically better off, but even in the middle class, which becomes a source of problem. Second thing is, we should be very particular to know about the family history. If a person apparently is healthy, but there is a family history of blood pressure, heart attack, stroke, or sudden cardiac death, that should lead us to think whether there are any inherited problems, as many a times coronary artery disease is also hereditary besides diabetes. And all these taken into consideration, if we have a person who is maintaining a proper weight, he is maintaining a proper diet, does a regular exercise, has got his blood parameters correct, and on a regular checkup, supervised, everything is normal, we can certainly say that you have a healthy heart. Well, in reply to your question, what is heart attack and why does some get a heart attack? The heart is a pump which supplies blood to each and every organ of the body, and blood carries oxygen and nutrients, which is essential for every cell to live. Although the heart supplies the whole body for its own requirements, it has its own blood vessels. These are known as the coronary arteries. It is just like you have a petrol tanker which carries petrol for the whole city, but it requires its own petrol tank for the truck to move. Same way, these coronaries are healthy in most people, but because of disease and many risk factors like hypertension, diabetes, raised cholesterol or bad cholesterol in the blood, genetic factors, various stresses the person is subjected to, the blood vessels start getting narrowed. And if they are gradually getting narrowed, person gets warning attacks and there is time enough to intervene or save him. Unfortunately, many a time there is something called as a plaque rupture, or the vessel closes down suddenly without a warning, and that is called as an acute heart attack, where we have to act very fast in order to prevent damage and save life. So whenever there is a cessation of blood supply to the heart cannot contract and it stops contracting, or the contractility becomes low, which is a very serious condition which has to be attended very fast by opening up the vessels, and a person gets a heart attack. And who will get it? As I mentioned, the various predisposing factors, and usually it occurs in the middle ages, but unfortunately in the Indian subject, we Southeast Asians have the maximum incidence of heart attack compared to any race in the world. We find this occurring even in the late 20s, 30s, and very often in the 40s. So this is a matter of great concern, and which is one of the biggest killer of our times, and which we have to address. Well, your question was that all chest pain need not be an heart attack. How can we differentiate? Well, very frankly, it is sometimes difficult even for a doctor. You can only give the best probability. There was a study in which they had found out in a Western country in UK, all the cardiologists who had a heart attack, how many of them could identify their own heart attack? Surprisingly and shockingly, it was found that most of these heart specialists, when they had an heart attack, they thought it was something else. So, what do we expect of the general public? But usually, whenever a person starts getting gripping pain in the region of precordium, when he cannot localize, if someone points with a finger, it is a localized pain, usually is not a cardiac problem. But when he cannot localize, he says it is deep seated. It may be on the left side, it may be on the precordium. It is usually never a pain, it is a pressure. They say, like in the local language, छाती पे वजन पड़ रहा है, काहीतरी माझ्या छातीवर दाब पडते, pressure आहे. Then you should really think that this person may be having a heart attack. This pain may not only be in the chest, it may radiate to the left side, usually on the medial aspect of the arm, and even on the right side, it may go towards the jaw, it may go towards the back. And there are many constitutional symptoms like unexplained sweating, there may be vomiting. Patient will tell you that something is not right, a feeling of doom that he is going to become critical. Sometimes they may have extreme fatigue, weakness. They may have a spell of unconsciousness when the BP drops. And these are all the symptoms which are, of course, very prominent that there is a heart attack. But in most other times, sometimes in a diabetic patient, in an elderly patient, you may not even have the signs and symptoms, and then you may have to admit the patient and watch them serially. Whenever there is a doubt, you should always keep the patient admitted and then follow up with the blood test and then conclusively prove or disprove whether a patient has a heart attack or no. So whenever there is pain in the chest or over the precordium, it need not be an heart attack. It may be a muscular pain, it may be acidity, it may be a condition related to the lungs, pleurisy, or pulmonary thromboembolism, which is another serious problem. Sometimes the vessel of the which goes out from the heart, the aorta, dissection, another serious problem. All these cannot be managed, and it should be seen by competent medical authority. Patient should be kept for observation, certain investigation should be done, and if all the tests are normal, usually a person has to be kept for observation for a day or two, and then after the test are fine, we can conclusively rule out that there is a serious problem, should be treated, or not, then we are sure that there is no major problem. Now, are there any other diseases which are not due to a heart attack? Of course, heart attack is only one problem where the blood supply to the heart is compromised, giving rise to a myocardial infarction or heart attack. But there are many, like 1% to 2% of the children are born with congenital heart disease. There may be holes in the heart or the heart may be malformed. Fortunately, we have got treatments for most of these disorders in these small babies, which can be picked up even antenatally, or that is when the baby is in the womb or immediately after birth. And then there are diseases which occur in our country. Fortunately, the incidence is decreasing, called rheumatic heart disease, which is secondary to infection, where the walls get damaged. And then there are viral infections which can damage the heart in the form of cardiomyopathies. And as you age, you have diseases of the coronary, diseases of the aorta, and so on. So there are many diseases which are related to the heart and the cardiovascular system, and which should be properly diagnosed, which can be diagnosed, and now we have got very successful treatments. Well, this is Dr. Vinod Vijan again talking to you from my cath lab. Your question was, sometimes even a healthy person can die of a heart attack. Is it possible? Well, it is a matter of how you define what is apparently healthy, or is it supervised, or sometimes the person has never been to a doctor, never investigated himself, and thinks that he is healthy. That is a misnomer. But there are many subsets where a person who is an athlete indulges in a very strenuous activity, especially nowadays we have these marathons. We find many people collapsing and dying. It is possible it can occur. We have seen this in certain condition called hypertrophic cardiomyopathy, where the muscles look more hypertrophic. Such patients are prone towards sudden cardiac death, which is known. There may be some, even many times you find a person not used to alcohol takes a binge of alcohol and is intoxicated and can even lead to arrhythmia and is found dead next day. So even if a normal person has never done any exercise and indulges into a very strenuous activity, can have a very unfortunate event in the form of ventricular fibrillation and death. So these are uncommon conditions, but more often is when we say that a healthy person has died is actually a person who is harboring coronary artery disease, has never been investigated, has had certain amount of coronary artery block, and due to certain reasons there is a rupture of this unstable plaque leading to an acute occlusion of the coronary artery and leading to death. I will just give you an example here. Is what we have is a gentleman who had been for a walk in the morning yesterday and even had a regular exercise in the afternoon, complaint of chest pain, and immediately he had a heart attack, was referred, and we can see that the main vessel is totally cut off, and this is what we found out, and immediately we went ahead, did an angioplasty. We could open up the vessel and save the person's life. So that brings us to a question of what should be done if a person has a heart attack. You see, the current most modern form of therapy or treatment is such patients cannot be treated at home, cannot be treated in any dispensary or any hospital. In fact, the latest treatment of an acute heart attack is not even the ICCU or the coronary care unit, but the treatment is in the cath lab. So most of the advanced countries and Mumbai and even cities like Nasik, when a patient comes in time, the best way to save a person's life, to reduce the severity, intensity of a heart attack, is immediately to take him to the cath lab, and what we do is called as PAMI, or primary angioplasty in myocardial infarction. This has got better results, saves more lives than if the patient is given drugs or is stabilized in the ICCU. And that is very important message which should be understood by the lay persons and public, and that will lead to more lives being saved. Now, as regards the question, is it possible to live a normal life after getting a heart attack? Yes, of course. Our aim as a cardiologist, as an interventionist, is to send back the patient back to society from where he has come. He has come to us in a very acute sick condition, and we try to save the heart, restore it to the maximum possible, and allow that for healing and send him back to society. That is the beauty of treatment. But one should remember that there are limitations. I have seen executives who have never had more than a briefcase which had only a check and a passbook, and after a heart attack they feel so guilty that they start climbing mountains. That you should avoid. If you have taken a proper treatment, most of the patients can lead a normal or a near normal life. If the heart is very weak, we even implant AICD or implantable defibrillators so that the risk of sudden cardiac death is avoided. And this is being done with increased frequency even in tier 2 cities like Nasik. With a very early approach, like patients being brought to the cath lab, we are getting more and more people even with major attacks having lesser and lesser damage. And such patients, they should remember, should never stop the treatment, be in regular touch with the doctor, change their lifestyle, and have an emphasis on their food management and exercise, can lead a very healthy, happy, normal life. I am very confident about that. Well, coming to your last question, What is the message to lead a very healthy, happy life with a healthy heart? It's very simple, and there are few steps, there are few uh, rules in this game, I would say, which you have to follow, and everything would be very easy. First of all, is have be in regular touch with your doctor. Go for a periodic checkup. Once you are above the age of 40, certain blood tests and tests like a stress test, sometimes an echocardiography, and if there is any doubt, a test like even a dopamine test or a coronary angiography, that would tell you, which is a gold standard in treatment, in diagnosis of a coronary artery disease, and can even give you the best options for treatment. More than that is, always have a regular exercise program. Whatever is your busy schedule, please do get time for exercise, and more important, have a good at least 6 to 7 hours of sleep. Sleep deprivation also is another important cause of stress, and puts a very has a negative effect on the heart and the whole body, I should say. Then would be the diet. Again, an emphasis on not to have junk food. You should be eating more of fresh fruits and salads, greens. If you are a non-vegetarian, cut down on red meats, cut down on cholesterol like the yolk of an egg, and take more of fish and poultry products, that also once or twice a week. So this is as regards the fruits and salad and regarding food. Most important would be now is not only exercise, but keep your mental status very relaxed. Today in this very competitive atmosphere where everyone wants to climb the ladder of success fastest, they really leave back many things in their life, and they are always, I find, people are unhappy. Rather than looking at their achievements, they look at the others' achievements and remain unhappy. So this attitude should change, and what is important is it should be inbuilt once they are even in their adolescence or as children. Parents have a responsibility that none of them should always insist that you should come first in the class. This unnecessary, unhealthy competition, rather than excelling in knowledge, they are only keeping the track on the ranks and the mark, and success in as a criteria leads lot of disillusionment, disappointment, and negativism in the children onwards, and which grows up with age. All this should change right from the beginning, is very important. I did mention about take your medicines and always have faith in your doctor. Most of the time I find people, they try to read something from net and Google, and they get more and more confused because they can get the information but not the knowledge or the wisdom how to use, and keep moving from person to person, and that's how make a mess of themselves. Have faith in the medical system, and most important of all, that every person should take insurance very seriously. Today, all these modern medicine, the therapies, whether they are bypass surgery or angioplasties and all, are costly, and if you are well insured, I find that those patients are very well relaxed. They tell doctor, go and give me the best. And there are people who have taken things very casually. They are very reckless in spending on their sports car, on the best of watch and everything, but have never insured themselves. And should something go wrong, then everything crumbles because they do not have the finance to spend on their health care. That is important. And most important again is a very, very strict no against any form of tobacco in the form of smoking, cigarette or bidi, or any type of tobacco in the form of this jarda should be totally avoided, banned, and even try to dissociate from people who are smokers. That is why even in airports and other places there are smokers lounges, and make sure that if you follow all these simple ways of life, you will certainly, even if a person is unfortunate to have a coronary artery disease, can lead a very healthy, happy life. Thank you very much. Jai Hind.